Kid was white as a piece of paper, shocky, sick. I didn't know what he was. Called 911, called the ER, said, I don't know what this kid has, but good it's not.
Yeah.
Ended up in the ICU, rule out sepsis, rule out seizures, rule out this, rule out that, and just would not get better. They looked at the newborn screen, and the newborn screen was normal. Somehow they ended up figuring it out many weeks later that the kid was having a thyroxine deficiency. Ended up a month later, she got a liver transplant at 1 month of age. The patient is like 20 something now. She already had her second liver transplant.
What an amazing story.
Oh, that was a kid. You look at the newborn screen, it wasn't on the newborn screen. Second kid is born 2 years later. And I recognized him. I went to the nursery, and this kid was totally normal, was already seen twice by somebody and in the hospital too. And then when I saw the name, I remembered, and I went over to the neonatologist. Oh, that child ended up in the NICU, but nobody knew about the sister.
Yeah.
Neonatologist, the sister had a very turbulent manifestation of thyroxine deficiency. You should check this kid out because it's not on the newborn screen. Of course, they blew me off. What do you know? And then they finally did it. And the kid was lacking in thyroxine. He had thyroxine deficiency also. They changed the formula, and the kid's in college. And he just has a special diet now.
Yeah.
It's perfectly fine. So you averted another disaster. Now they do the thyroxine in the newborn screen. But these kids didn't have that luxury.
Yeah. It is remarkable. And I feel like the newborn screen is obviously life-saving, and the goal of the newborn screen is different in that its purpose is exactly what you've described, George, is to identify children who without intervention would have life-threatening or permanent disability if not discovered in the first weeks or month of life. So with the thyroid's on there because of the profound mental impairment, even though that may not appear in the first weeks of life, it definitely would easily go missed. And nurture screen is a little bit different in its goals because many of the conditions that are screened for may not appear in the first weeks of life. Some would, or first months of life, but many may not manifest symptoms until a bit later, so up to age 7, 8 years old, but have profound effects and often have similar overlapping symptoms with so many other things that discovering what it is often can take 3 to 5 years because of the nature of the beast, right? If you're looking for something rare, you don't put it on the top list of things to look for initially. And as a result, it often takes a very long time to figure it out once these symptoms present. And as a result, there's missed time for treatment. So progression has occurred during that gap of that diagnostic journey.
This episode is sponsored by our friends over at Freed AI Medical Scribes. What if you could take the computer out of the physician-patient relationship? With Freed, you can. Freed is the AI medical scribe that listens, transcribes, and crafts perfect soap notes for you seamlessly. This isn't just another productivity tool. Freed is a life-altering solution for physicians, helping you regain the joy of practicing medicine. Freed frees you from the burden of documentation, so you can focus on what really matters, your patients. With Freed, the computer is no longer a barrier. It's a quiet assistant that works in the background, capturing every word of your patient interactions, accurately and quickly. The result, you're fully present in each visit, building stronger connections and offering more attentive care. And when the day is done, your notes are too, leaving you with more time to focus on yourself, your family, and your life outside of medicine. Freed is the solution thousands of physicians swear by to reclaim their passion for medicine.